Sometimes I'll hear a song that really makes me think about the type of topics that I research and the type of topics that I give lectures on related to mental health and addiction. I recently heard a song that really made me think about these topics, specifically co-occurring mental health and substance use disorders. The song is called Hey Sarah Part 2 by FCG Heem and Polo G. And so there are several different themes that are covered in the song, from domestic violence to self-harm to substance use to addiction to mental health disorders. And actually a lot of different details about topics related to mental health and addiction. But I just want to highlight a specific line in the song where the artist described using substances to cope with a mental health disorder. I can't say what the specific lyric is because I'm afraid of copyright issues, and lawyers are going to lawyer, and I don't want any smoke with any lawyers. In fact, I actually had to go through the copyright process for a different song, this Juice World song called Maze, and going through that full process and seeing how it can take some time when I was writing this preprint paper. I'll show it right here. So I may actually cover this paper right here in a different video, but it can take some time to actually get the copyright approval to be able to say these things. So I can't say the exact lyrics, but what I can say is I can essentially paraphrase it. So the artist said, "I'm using drugs because I have depression." And again, that's a paraphrase. You could probably look at the lyrics and see exactly what was said. And again, when I heard this, I really thought about this and how it captures a reality out there for a lot of people. Because so many people out there are impacted by negative mental health conditions or negative mental health stressors that they may feel as though they can't engage with the clinical treatment care, or they feel as though they have no support or services that are out there for them. So a lot of people engage in potentially even more harmful activities of using a specific substance to cope, which could lead to a substance use disorder or addiction at times. But there is oftentimes this internal acknowledgement of using these substances to cope. And again, if you look at this lyric in the song, and again, I can't say word for word what it is because I'm afraid of copyright issues. But if you look at what the specific lyrics are, which, again, paraphrasing, I'm using drugs because I have depression, describing how this specific mental health disorder is causing so much distress and so many issues that in order to deal with this, I am engaging in this and using these specific substances to reduce the symptoms and reduce the potential impacts of this mental health condition on my life. Because again, there is an inherent risk there. If you are navigating through coping with these mental health stressors by using specific substances to cope with it, there is a risk there of developing a potential substance use disorder, which then would potentially make the person meet the criteria of having a co-occurring disorder or a dual diagnosis, which is essentially just having multiple diagnoses. So in this case, it would be depression and then a substance use disorder if someone continued to use substances to a point that they developed a substance use disorder. And so let's really think about how impactful that can be if someone is at the point where they believe that the only way that they can navigate through the pain and difficulties, mental health difficulties that they're dealing with, is using a specific substance. We must ask ourselves, as a society overall, what can we do to increase treatment access? What can we do to enhance the availability of different services for folks who are struggling with these conditions? What can we do to enhance the social supports that they have, recreational supports, occupational supports, things that can allow them to live the best high quality life as possible so that their quality of life improves and that they receive effective treatments and have an overall reduction of their mental health symptomology. Then a big part of that is reducing the stigma that often comes along with mental health disorders and substance use disorders. Because for most people, it always comes down to that's those people's problems until it becomes your problem, or until it becomes your family member's problem, or one of your the problem of one of your friends. And then you realize how interconnected this all is. Because ultimately, we're all in this thing together, whether you want to admit it to yourself or not. Just something to think about. And this was just inspired by that song, Hey Sarah Part 2. So with that, I thank you so much for watching this, and I hope that my words resonate with someone out there. Thank you.